Well, anyone who's gone through a major health struggle can likely attest it's not just a health issue you're battling, it's often the insurance companies approving your care. It's a conversation that's come into focus in light of the recent killing of United Healthcare CEO Brian Thompson. Yesterday, one prominent New Jerseyan shared his story. Brad Schnoor, the former Senate Republican Communications Director, held a virtual press conference to share how he had to battle his insurance provider after his cancer diagnosis. Senior correspondent Brenda Flanagan has his story.
I was denied a relatively inexpensive scan that could have caught my cancer when it was still curable. I want to make sure that nobody else has to go through that.
Brad Schnoor's battling terminal lung cancer, a disease he believes progressed undiagnosed to stage 4, partly because his health insurance denied coverage for a CAT scan in 2022, before the cancer had spread. That same year, a survey showed more than 90% of doctors reported patients had delayed health care because insurers denied prior authorization. Public frustration over the issue exploded after the recent assassination of United Healthcare's CEO.
All the response to the death of Brian Thompson, I think that people are outraged and they're not afraid to do something about it. And they're not afraid to tell people that, the system is so wrong that we're gonna go out and do bad things, and I don't think that should happen.
Schnoor expressed his alarm in an op-ed piece that ran on NJ.com, urging a legislative solution co-sponsored by Republican Senator John Bramnick. The bill prohibits health insurers, third-party administrators, pharmacy benefits managers, and other plans from requiring the pre-approval of medical tests, procedures, or prescription drugs covered under a health benefits or drug benefits plan. Bramnick, who's running for governor, says it will be an uphill fight.
And I know I'm right, but the insurance lobby and the insurance companies is extremely powerful, extremely powerful. But what is right is right. And I want doctors making decisions with patients, not bureaucrats at insurance companies.
Bramnick's been pushing the bill for years, saying lawmakers have usually approached the problem piecemeal, targeting specific medical tests and treatments. In fact, a new law will reduce insurance pre-authorization delays by requiring answers within hours on urgent cases in New Jersey. Bramnick's not swayed by industry arguments that some doctors go overboard on expensive testing.
If there are doctors that are overdoing tests, that are unnecessary tests, then the insurance company should identify those outliers, and those outliers should be reined in, and they should be subject to pre-approval.
But prior authorization's not just red tape, according to an industry executive who stated its goal is to provide the right care at the right time in the right setting and to allow for the efficient allocation of resources.
I think that the insurance company's view of cost savings derived from prior authorization is extremely short-sighted.
New Jersey's Medical Society Council notes the time spent by nurses and doctors and insurance company staff wrangling over treatment requests just drives up costs for both sides and patients.
If they're not getting the care they need when they need it, I think the clear answer is to reduce this level of waste so that the entire system is functioning better and serving patients better.
And delays in needed health care end up costing everyone more.
You have patients who can end up back into the hospital without the medications that they need. And so really it comes down to what we need to do for patient care, and streamlining the process is really what's in the patient's best interest.
The third-party company that denied Schnoor's CAT scan, eviCore, didn't reply to requests for comment. Schnoor says the company still argues with his doctors at Sloan Kettering over treatment.
I get another denial letter probably every 3 months.
Schnoor, who left his job at the State House as head of communications for Senate Republicans, says he will keep pushing for reforms. I'm Brenda Flanagan, NJ Spotlight News.